Hello everyone, this is Nicole Freeland, and today we are discussing Chapter 21, the Neurologic System. Objectives for this chapter are: the student should be able to discuss the organization of the nervous system. You should be able to link the 12 cranial nerves and their functions within the nervous system. You should be able to examine the differences in the action of the sympathetic nervous system and the parasympathetic nervous system. You should be able to determine the age-related changes in the nervous system, describe how the nurse will evaluate the neurologic status of a patient, and be able to discuss the common neurologic patient care problems a nurse may encounter. What is the organization of the neurologic system? First of all, the neuron is the functional unit of the nervous system. And the nervous system consists of two systems. Those systems are the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain and the spinal cord, and the peripheral nervous system is composed of sensory organs such as the eyes, ears, taste buds, the olfactory receptors, and touch receptors. 12 pairs of cranial nerves help with these senses, and 31 pairs of spinal nerves are present. The functions of the division of the brain, we can divide those into three separate categories. Those would be the cerebrum, the cerebellum, and the hypothalamus. So the cerebrum is the center of intellect and consciousness. It receives and interprets sensory information. It controls voluntary movements and certain involuntary movements. It's responsible for the way we think, learn, language, our capability, our judgment, and our personalities. And it also stores memories. The cerebellum is responsible for coordinated movement, posture, and muscle tone that are mechanisms of balance. And then our hypothalamus, it controls our body temperature, our appetite, the water balance within our bodies, and it links nervous and endocrine systems together. Here you see a table of the cranial nerves and their functions. Cranial nerve number 1 is our olfactory sense. It is the smell. While 2 is optic, it controls our sight. 3 is oculomotor, which controls eye movement and pupil dilation. And then you can work on down through the 12 cranial nerves. Here you see a mnemonic that may help you to remember the 12 cranial nerves. It is divided into a mnemonic that will help you remember which cranial nerve you are using, and then if it is a sensory, a motor nerve, or both. So the autonomic system of our PNS is divided into sympathetic nerves and parasympathetic nerves. The sympathetic nerves mobilize energy to initiate changes aimed at maintaining or restoring homeostasis. The autonomic effects for the eyes, for the sympathetic system, it causes dilation. The blood vessels The sympathetic system causes constricted blood vessels and therefore elevates blood pressure. For the heart, it increases the heart rate, and for the lungs, it causes dilation of the bronchi. The parasympathetic nerves conserve and restore energy that has been used to maintain homeostasis. The effects of the parasympathetic nerves on the eye are to cause constriction of the pupil. For the blood vessels, it causes little to no effect. On the heart, it causes the heart rate to slow. And for the lungs, it causes constriction of the bronchi. Special characteristics of the nervous system are discussed on page 476. These include cells in the brain that cannot be replaced once they are destroyed, and neurons in the brain cannot survive without oxygen for longer than 4 to 6 minutes. Now we'll discuss some age-related changes that occur within the nervous system. The first one is the loss of neurons with aging. Neurons are lost and we are not able to regain these as we age. There's also decreased blood flow with advanced aging. We may experience slower movements, slower response times, and decreased sensations. Our body's homeostasis is more difficult to maintain, and if it is out of balance, it's more difficult to regain. The learning process is slowed. Recent and short-term memory are affected, but it seems that distant memory is typically not affected. The peripheral nervous system, the motor nerves and fibers within the myelin sheath degenerate with advanced aging, and the reflexes become diminished or absent as a result of this. Also, you may see that the pupils decrease in size and are more sensitive to light, thus needing more light for activities such as reading. And then it is important to utilize the brain and to keep it active to promote intellectual functions. So, prevention of neurological disorders. Patient education is key here. We really need to educate our patients about the dangers of recreational drug use. We need to promote immunizations to help reduce the chance of Contagion. We need to control hypertension and cholesterol to help reduce potentials of blockage of blood vessels and then therefore maybe a stroke. We need to educate them over the symptoms of a stroke, and then that early treatment is really important for better outcomes. And then we also need to educate our patients to protect themselves from various poisons such as pesticides and chemicals that are found within and around our homes. So to evaluate the neurological status of our patients, we can do some neuromuscular function tests. This tests a group of large muscles with gait being observed, their hand grip strength being observed, arm and leg strength also being tested. Different tests that can be performed are lumbar puncture test or a spinal tap. This is to determine if the cerebral spinal fluid pressure is elevated. If there's a blockage of flow, we would inject medications and then obtain fluid from chemical analysis and cultures. An EEG is used to detect abnormal brainwave patterns that are indicative of specific diseases, such as seizures, some brain tumors, possible CVAs, head traumas, and then infection. And we can determine if there is cerebral death as well. And then PET scans, or positron emission tomography, it assesses for cell death and damage in brain tissues. You need to have your patient sign a consent form before this procedure is to take place. They will need 2 IV lines in place. You cannot use sedatives or tranquilizers before the test, and the patient is encouraged to empty their bladder before the test begins. There is no other special prepping required for these patients other than those listed. You may assess your patient's reflexes through action or movement that is built into the nervous system, and it does not need the intervention of conscious thought to take place. So reflexes that we can test are the knee jerk, the bicep reflex, triceps, and Achilles tendon reflex. To grade the reflexes, we grade on a 0 to 5 scale. 0 is being absent, 1 would be weak, 2 would be normal, 3 is exaggerated, and 4 would be hyperreflexia with clonus. So this is a continued rhythmic contraction of the muscle while there is continuous application of the stimulus. So if you are testing that reflex and you continue to apply the reflex pressure and you observe a continued kind of contraction of that muscle, that is called hyperreflexia. Babinski's reflex is elicited by scraping an object, such as a key, along the sole of the foot. A normal response to this is the toes bend downward. Positive or abnormal response of a Babinski's reflex would be that the great toe bends backward or upward, and the smaller toes fan outwards. If positive in an adult not under the influence of chemical substances, this indicates an abnormality in the motor control pathways leading from the cerebral cortex. So to evaluate your patient's neurological status, you would first start off with a physical assessment. You will assess their vital signs. You will observe their temperature. It's important to note that temperature can be increased due to infections, but it can also be increased due to the damage of the temperature control mechanism within their brain. That's actually an indication of increased intracranial pressure, or it can be a sign of increased intracranial pressure. If your patient is experiencing ICP, their blood pressure will rise in systolic pressure, and then there will be a widening pulse pressure present. Their heart rate will be slow and bounding, and their respiratory rate will be irregular and labored. You will also want to monitor their mental function and their level of consciousness. So this is done with a couple of different tools. First off, we think of using the Glasgow Coma Scale. This evaluates your patient's level of consciousness by testing eye-opening, their best motor response, and their best verbal response. They can receive a total of 15 points. However, a score of 8 or less indicates a coma. The 4 score is a tool used to assess comatose or intubated patients who cannot speak for themselves. There are a total of 4 areas that we test, and they can receive a maximum of 4 points in those areas. The areas that we test are the eyes, the motor response, the brainstem response, and the respiratory function. Evaluation of thinking by asking the client to add 3 numbers together or solve a simple puzzle is a way to evaluate their thinking process. To assess judgment, we can assess whether the client can make rational choices. For example, we give them a question such as, would she be able to do a fire drill? What would they do if there was a fire in the trash can? We need to evaluate their judgment call after we ask those questions. And then neurologic and neuromuscular status, it can be assessed by performing different tests on your client, such as checking their pupil response to light. We can ask them to shrug their shoulders. We can assess their hand grips, their foot pressures. We may ask them to smile, frown. We may assess their range of motion. And then we can also assess responses to pain. 2 non-purposeful responses to pain would include a decorticate posturing, which is a flexion inward towards the body, or a deceribit posturing, which is the extension of usually their arms or hands out away from their body. And then their pupils, we will assess, like I said, are their pupils equal, round, and reactive to light with accommodation? And if one pupil remains fixed and one is dilated, that is also a sign of increased ICP. So some common neurologic patient care problems that a nurse may encounter are ineffective breathing pattern is the first one we will discuss. This can be due to a weakened diaphragm that might occur with neurological disorders. We can also monitor their respiratory effort, and then we would promote client airway and chest expansion. We can also monitor for impaired mobility. By doing this, we would ask them to do range of motion exercises. We may also monitor for hemiplegia, which is paralysis and loss of sensation in an extremity. If this occurs, the patients need education on becoming aware of the arm or the leg placement when turning or transferring to help them prevent injuries. And then we may also see hemiparesis, which is just one-sided weakness, not paralysis itself. And then we would educate these patients on how to strengthen their muscles and use assistive devices. We may also see tetraplegia. This is simply a new term for quadriplegia. It is where the 4 limbs are paralyzed. We would help cope with drastic life-changing alterations. We would assess how their energies might be directed towards different outlets. And we would also help them to identify attainable goals for themselves. Another area we would need to assess would be for dysphagia. This should be assessed on any client who has suffered a neurological insult. If a client has dysphagia, they would sit upright in a high Fowler's position to eat, and they need to maintain that upright position for 30 minutes after they eat. This is to avoid aspiration of any abdominal contents that may come up due to a result of weakened stomach muscles following a neurological assault. And then they may also need to be tube fed if they're unable to swallow without choking. We can also monitor their incontinence level. We can provide bladder training, which would include toileting these patients every 2 hours on a schedule. You would provide 2,000 to 3,000 milliliters of fluid intake If that is not contraindicated for some other reason, we need to understand that there is an importance to maintain an accurate training schedule. And then they must continue for a minimum of 6 weeks before determining if the training was successful. We can also assess confusion. Confusion can be acute or long-term. It can be mild or severe. It's important that the client is supported and protected from injury. And then if there is severe confusion, such as delirium, hallucinations, delusions, and severe agitation, we need to help protect them as well. Safety is a priority. When assessing aphasia, this is simply a defect in the ability to express oneself in speech or writing, or an inability to comprehend spoken or written language. It is important to give them time to respond to questions. We need to give them adequate feedback and praise them for attempts at communication. And then we do not need to correct the client's pronunciation. That may actually cause them to become frustrated. It is just very important to remember to be patient with your client. So to summarize, these are questions that I would like for you all to answer. Please address the questions, type them, and send them to me after you have answered these questions. This should be a short activity that you can complete before 2:45 today. So I will have an assignment submission area where you can submit the answers to these questions for me, and then you are done for the day. I will be with you next class period on Thursday. We will be online again, and we will be discussing chapters 22. You will start off with a short Kahoot quiz for chapter 21, and then we will move into a PowerPoint over chapter 22, and then there will be a short Kahoot quiz following your lecture on chapter 22. Please keep in mind that your medical terms have become available to you today for these 2 chapters, and your ATI activity has also opened up to you. And I will see you, quote unquote, this coming Thursday. Thank you. Bye. So to review for chapter 21, I have 6 questions listed here. I would like you all to answer these questions, type your answers to the questions, and then there will be an assignment submission place in Moodle for you to submit the answers to these questions. And then you are done for today's activities. Next class period, this coming Thursday, we will be online again. We will be discussing chapter 22. You will have a voiced over PowerPoint. We will most likely start off the day with a short post-lecture Kahoot quiz for chapter 21, and then we will move into the PowerPoint with chapter 22. It does say on the calendar on Moodle that your medical terminology worksheet and your ATI assignments are due. However, I would like those to extend to next Tuesday, October 13th, to give you guys more time to work on these. That will be the day that we take exam 6 for chapters 21 and 22. So please know that the due date on your medical terminology worksheet, your MedTerm quiz, and your ATI assignment will not be due until October 13th. I will also send out a course announcement for you all for this as well, but please just keep in mind those activities are not due until then. Thank you all for your time, and I hope you have a great afternoon. Bye.